Yes, please excuse me, pardon me. There have been mixed reactions to my interactive ways of doing it. Thanks for the feedback, all of you. It has been very helpful. I will come to some of those specific questions that were asked, and then I will answer them, and then we can go to the next one. Um, so the third thing is that in addition to being interactive, that is, I will always request people to have their hand on the buzzer, that is the mute button. So I would be provocative today. So bear with me, but that is not without evidence. Just that there will be some provocation because we are dealing with, I mean, we might deal with a sector called private sector. So there will be emotive reactions maybe, but yeah, I will be um, asking your permission for two things. Don't please mistake me to be patronizing. Just to get everyone to the same uh, plane, I do that. And second thing is, I don't, I feel PowerPoint presentation is more patronizing and didactic. So that's why I try to make it as interactive as possible. And third would be that I would be really provocative today. So I hope I have the permission. Okay. Another small casualty that I'm seeing is that the people who attended last time, I think half of them have only come. The rest of them are new. I hope they caught up on the video and will make good the previous session and then allow me to continue with this session. Okay, 2-3 questions I wanted to answer from the feedback. One is that please liberally use the learning management system to share your thoughts. I think some fantastic reflections were put up as feedback, which unfortunately only 2-3 of us are privy to. We can as well make it a discussion forum where everyone can learn from. For example, one person, I don't know who it is, even though I can guess it who it is, has gone on a long explanation of Michael Marmot's social gradient. That would benefit everyone. Gayatri, if there is a way to share that, we can put it into the discussion forum ourselves for the time being. But I just wanted to guide you to the discussion forum that is available on the platform for all of us to engage with it. Sorry, let me see if I can share that. Where is it? Here. So everything is here. All of you, please, you can use liberally this whole what you call platform for you to engage with the topics. So I would also be happy to what you call answer questions, respond. The others can respond, not that I will be all knowing or some of us are all knowing. So please liberally use this. Where is the, yes, here. If you go to this course, there is a discussion board. Yeah, discussion forum. Please use this liberally, add a topic, and then we can take it forward. Yeah, that much about the learning management. There are, of course, lots of literature put in there and also some debates between leading economists. You people can have a look at it at your leisure. Okay. Now, I'll start with answering some of the questions that were asked and also to cover some of the...
Prasanna, your screen is still being shared.
Oh. Is it shared?
Yes. Just change the tab and you can share this. Stop. Yeah, that's fine. Your presentation is now visible.
Okay. One or two things. There have been requests for going slow.
Can you hear me?
Yes, Anthony.
Yes.
Yeah, I'm sorry. Before you begin, again, I know the expectation is that new people are supposed to sort of be up to speed and come here. But if time allows and if you think it's possible, could you just give a very quick sort of a summary of what was covered last time? Just so people are also up to date on what's happening today. If possible, very quickly, 2-3 minutes, can you do it?
Yeah, Shantan, I just
Gayatri
gave
did
a
that.
summary. Just
Okay, fine. Sorry, I joined it. Thank you. Okay.
Thanks, Anton. I don't know how to spell your name, but anyway. Okay. One or two things that I wanted to clarify. One was that last time somebody asked me. I don't know if that person is still here. Is the inequalities correlated with bad health, or is it what you call what does it say? A causation for bad health? I did look up literature subsequently because even though I answered it last week, I wanted to be very sure. Yes, there are epidemiological studies which show that there is causation between inequalities and health inequalities. So that's not just merely a correlation, but also causation. Second thing is about the long message regarding Michael Marmot's social gradient. There have been enough literature written subsequent to Michael Marmot's presentation about the Whitehall study, in which it was not just only poor and rich, but it was also about different categories of people where they find themselves in the society. Yes, there are now concepts that have come up as to the health inequalities due to um, powerlessness, and also there are new concepts like um, control over destiny. So how much control over your destiny you have also determines how healthy you can be. So invariably, it is all dependent on socio-economic conditions, and that is a given thing. So the poorer people generally have lesser power. They feel they have a sense of powerlessness, and also they don't seem to have a control over their destiny. So, for example, there's a fantastic paper by uh, Margaret Whitehead on what does control over destiny mean for people and health inequality. So, I can just display 2 minutes, and then we can move forward. Yeah. So, to explain Michael Marmot's social gradient, I think one of the most important ways to look at it is to look at it as a power issue and powerlessness and that sort of a thing. Where is it? Okay. 2 minutes, I'll share this and then we can move forward. All of you able to see this literature?
Yes.
And there is also lot of writing from a group within Lancashire University, which has done enough studies for NICE, wherein they have looked at powerlessness, they have looked at power differentials, and also looked at inequalities and proposed for NICE. NICE as in the NICE institution, National Institute for Clinical Excellence, if I'm not wrong. Yeah. So they have generated a series of it, led by Jeannie Poppe from Lancashire University. So all of you can refer to those. Okay, I'll stop sharing. And there is also a request that I rush through the economics thing. So I will start from there. I hope that's okay. Any other questions you have? Anybody who wanted to ask questions previous week, we can start with that, or we can move towards this. Sorry, I will be starting the sharing, so I won't be able to see, I think, who
I'll
is
keep an eye
raising
on
their
the hand
Yeah,
raised.
thanks. Yeah, anybody, any questions? Okay, we can go forward. Okay, so why are we discussing? Another reason why I do a little bit more interactive and sound more patronizing is because I go from the basics, because these are not topics taught generally in a health, quote unquote, health course. So that's why I try and build the learning blocks and then move forward with basic banal concepts and all. Anyway, so why do we have to worry about health economics? One is, of course, delivery of health service itself is an economic activity. Like to do. Yeah, you have to build a hospital. Hospital needs labor, and also you need wages. You have staff. You need to pay salary. So it is a financial activity, and where finances are there, you need to bring in. I mean, one of the ways to do it is to bring in economic principles. So that's the understanding of why we need to look at health economics. Another way to look at health economics is, as I told you, economists are always concerned about one important aspect, and that is scarcity. The starting point for economics is about resources being scarce. So the way economists look at resources is a scarce commodity, and hence you need to be efficient. You need to get more from less. So that is the starting point. And in health economics, scarcity is defined a little differently. It is about the desire to remain healthy, which is a common desire, nothing wrong about it. But what does it imply is what is the issue for health economists. One is globally, we have largely aging population. And so elderly people require more healthcare than youth. So the desire to remain healthy creates scarcity. Second is the rise in real incomes, real as in adjusted for inflation. So income could be, last year you could be having 10,000, this year 15,000, but adjusted to inflation, it could be even 9,000 rupees, whatever. So increase in real incomes. So this is an economics theory, wherein they say healthcare seeking or healthcare access is income elastic, is the word they use. What does income elasticity means? More your real incomes, more your desire to seek healthcare. We look at, this is all conceptual. And of course, with the what you call latest improvements in medical technologies, there is always demand for new technologies and new vaccines, new medicines. So this again creates scarcity. That is, given the resources, for example, a state has or a government has, how does it cater to this sort of a demand? That's the question that economists always engage with. That when it comes to health, there is an aging population, so their health needs and healthcare needs are more. Then there is an income elasticity for healthcare, which makes people seek more healthcare as your income increases, and the ever-increasing improvements or ever-increasing types of medical technologies, the latest MRI or the latest robotic surgeries and those sorts of things. So given this scenario, economists say we'll have to be very mindful and then see how we can do the resource allocation. And of course, the other side is, of course, resources being scarce. So you have land, labor, capital. So because there is scarcity, there is a need to distribute resources for healthcare. That is the idea. And how does economists, how do economists deal with this? They deal with it through the market logic. The market logic is efficiency. But given that what we have seen, given the inequities that cause ill health, we need to also look at, for example, equity. How equitable is a decision made? So one is efficiency and the second one is equity. So when we talk about efficiency, there are two types of efficiency. One is called the productive efficiency. Gayatri could be having a splitting headache today, but if she is attending this session, she is considered as productive. But is she healthy? That's a different question. Or, for example, Arvindan could be having some issues at his house, but if he's sitting in this session today, it means that he is being productive. So the productive efficiency comes from the market logic. That is, how much are you able to do with minimal resources? So value for money is that productive efficiency. Then you have allocative efficiency. So how do you allocate resources? Will you give the current, for example, if you have 1 crore rupees in your hand, will you give 80 lakhs to cancer and 20 lakhs to heart operations and leave it at that? Or will you give more money for primary healthcare and then lesser money for cancer? So more people are the utilitarian principle, if people understand the utilitarian principle, that is more good for more people. So if you are able to reach, for example, 100 patients through primary healthcare, only one patient through cancer, then how do you allocate the resources? That's the question. And when it comes to equity, yeah, it's a question mark in the sense that do markets recognize inequities. And that's what we will start with today. So what economics does is it gives you tools for allocating resources. Am I clear now? Last time I ran through this, but this time I thought I'll take a little bit more time and then tell you. So economics is that sphere which gives you the tools for decision making as to whether you will give more money to primary healthcare or whether you will give more money to cancer, or whether you are buying paracetamol tablets more for 10 rupees, or those are the sorts of things that we deal with in economics. And economics gives you those tools to deal with how do you make decisions. Am I clear? So we understood this. There are issues that health doesn't follow market logic. So the economists never say that markets fail health. They say health is a market failure. So that's again the reversal of logic. But yeah, we'll go with that standard understanding that health is a market failure. We have seen that there is information asymmetry. There's a principal agent problem. You are not the ultimate decider. There is a middle person there who can be influenced from a 5-star conference to a trip to Singapore. So you are not the ultimate decider. We gave the example of Calpol last week. Exactly, I took Calpol as an example because Calpol is the costliest paracetamol in some sense. So instead of prescribing Dolo, or the chocolate of India now, a physician can take the decision that Calpol is better. So that is the situation with information asymmetry. Then we looked at externalities as to how if you give vaccines to people, 10 people will benefit from it through herd immunity, and then there are externalities. And then you have public goods, which are non-exclusionary, non-rivalrous. So also called by economists as a free rider. That is, you buy a Maruti car and then 4 people are riding free on it. So that is the logic of economics. Any questions till now? Any chat thing?
Nothing in the chat.
One quick question.
Yes.
So this allocative logic that you mentioned, so does it also entail ideologies or sort of, for example, logics like if it's given to the private sector, efficiencies will increase, or trickle down
We'll
effect for that matter?
Just
okay,
hold
fine.
on.
Sure, okay.
Just hold on. Are we okay with this? So what we said, because health is a market failure, you need invisible hands don't work. You need to have a visible hand. And that is Sayantan, in some sense, answering your question. There is always a visible hand needed. What I say public endeavor is through government actions, public actions. Yeah. Okay, so what does market logic say? Again, going back to our great philosopher, Beauchamp. Entitlements to people to what they have acquired. So no question of justice, no question of fairness. Whatever you have acquired is yours. And then there is also an emphasis on individual responsibility, again, a market behavior, that the individual is the problem. They indulge in unhealthy habits. They get into smoking and they eat McDonald's. They are the problem. So they need to take up more responsibility. So it is individual responsibility. I'm not getting into structural violence, but most of you who are familiar with Paul Farmer would understand what a structural violence is. That victim blaming is happening and takes the debate away from structural violence. Structural violence, as in what we saw, the huge differences in life expectancy, depending on the zip code, as they say. Yeah, within 8 kilometers distance, we can have phenomenal difference in life expectancy or infant mortality, whatever. And fatalism, I won't get into it, what it means, and weakening of collective endeavor. Yeah, you are responsible. So market depends on the individual, market depends on your buying capacity, and therefore collective efforts are not encouraged. I'll come to that as to why collective efforts are not encouraged. Minimal obligations to protect the common good. Again, politics. So, what is common good? That we are all in it together. There is solidarity. Those sorts of things don't work with market. And most importantly, Bhusha makes this point: over reliance on biomedicine for a painful social change. And here I give the classic example of malaria. Hands on the buzzer, please. Yes, quickly. Malaria is caused by or transmitted by
Mosquitoes.
which mosquito? Sorry for patronizing. Huh. Which mosquito? Female Anopheles. Fair enough. So when do these mosquitoes bite? Biting times in the day? Anybody?
Is it
Unmute.
Anopheles?
Yeah, it is Anopheles. What times during the day do they generally bite?
Evening, just
Early morning. Early morning.
Dawn and dusk. Okay, fine. So there is anybody from Jharkhand area here? Jharkhand, Madhya Pradesh, Chhattisgarh. Yeah, I see Vasu is already there. Anyway, so there is a tree called Mahua tree. Sorry, Mike, this is not for. I mean, this might be a little out of context for you, but anyway, How many of you understand Mahua? Mahua?
Yeah, Avani says she understands.
yes, I understand.
Okay, so Mahua is a tree which is used for what? I mean, Mahua leaves are used for what?
To produce alcohol?
Alcohol.
Everyone knows about alcohol, but not about the iron-rich Mahua laddus and all. Anyway, okay. So Mahua is iron-rich as well, but generally in tribal culture, it is used also for making liquor. Okay. Now, what is the culture or the social milieu in which the tribes access the Mahua leaves? Quickly, please. I need to move on. Anybody knows the tribal culture from those areas? What is the tribal culture or the social milieu in which the tribals access the Mahua leaves? Tribal economics, tribal culture, whatever. No? Bad luck?
Do
Okay.
you mean the way they celebrate everything with like
No,
alcohol?
how do they access? Supposing they want to see their economy is Mahua economy, for example. How do they have access to those leaves?
I may not be exactly sure, but I think prior to the Forest Conservation Forest Rights Act, they could simply just take it. Now I think they have to secure permission, go through the forest department, all of that nonsense to acquire it with something which natively grows and which they used to access readily.
That is
Again,
that
not
is one
sure.
angle. Yeah, that is definitely one angle. But the other angle is the culture is that that person has to be perched on the tree. That is, he or she has to be sitting on the tree from which the leaves will fall. For those leaves to be that person's. Are we understanding this? The leaves have to fall from the tree on which the person is sitting. Those are the leaves that that person can use for making laddu liquor and his or her economy. So when do leaves fall? What times of the day?
Times of the day or year?
Times of the day also. When do I'm not biology. I always said biology. I was very weak in biology. So I always had that fear, but I'm not biology. But generally, medicos, all of you are. So
Dusk
you
and
should be
dawn?
telling. Dusk and dawn. Okay. So what are the peak mosquito biting times?
The same.
Anopheles mosquito. Dusk and dawn. So where is this person sitting? On the tree. What is the solution provided for malaria? What is the solution provided for malaria?
Mosquito nets.
Mosquito nets, pyrethrin coated walls, insecticide treated nets. That is what Bhushan says, technological fix for a social change. So where is this person? Where is the wall? Where can the net be? So there is a regional malaria research center in Jabalpur. They did a study. They gave the nets to the tribals in Orissa and that belt, Chhattisgarh belt. And then they went back 6 months later. What would have happened to the bed nets?
They were
They were
unused.
catching fish.
Yeah, Sayant and Junaid.
Shantan said they were
Yeah, they were
used
catching
to
fish.
catch fish.
Yes. So they were either using it as for catching fish. Also in humid conditions, have any of us slept inside a bed net? Can you
Yeah, it's
imagine that?
horrible. It's horrible.
Horrible. So what Bryushaw fantastically says is you have to move towards social change rather than looking at the next ACT treatment. Treatments are important. We are not telling it's not. What we are telling is you need to look at the larger social issues. But market refuses to look at those, is what he's saying. And then there is a fantastic Hindi phrase, all of you are familiar. Jo jeeta wahi. What is it? Jo jeeta wahi.
Sikandar.
Sikandar. Yes. So winner takes all. If you are educated, if you are privileged, if you are dominant caste, if you are dominant class, you will get your US visa. Are we getting this? Yes. So the markets don't recognize the inequalities is what Bhushan is talking about, market logic. Then he juxtaposes it against the social justice logic. Am I still sharing? Yeah. So under social justice, you have collective responsibilities. And then he gives a fantastic statement. The dream of public health is of minimizing preventable death and disability, which is also the dream of social justice. Do we understand this? So social justice is a very powerful critique of the market justice. We will also look at the evidence now. And then final statement, what are the benefits worth if they have to be purchased at a human cost? I think this is what I wanted to juxtapose between the market logic and the social justice logic. Okay, so what did we understand politics as? Anybody? Test of me? I am being tested. What is politics? What are the definitions of politics?
Last time we said that as defined by Beauchamp, it's the search for common good, justice and fairness in society.
Also, politics is about power.
Yeah.
Politics is also about distribution of resources. Am I clear? So, Sayantan, to your question, economics gives you the tools for distribution, but the politics gives you the power to distribute. Am I making sense? Sayantan, this was your question, no? So what your politics determines what gets distributed. Whether you buy more Rafale jets with the money and reducing the reducing the budgetary allocation for women and child development by 50%, or will you give more money for universal health system, universal nutrition system? Are we understanding this? And that is decided by the politics. Am I clear? And we will look at what the evidence is to some extent. Okay, so some definitions. So these are all textbook definitions. We don't need to get too much worried about these. I'm not able to see my own screen. How does one do that? Sorry, 2 seconds. I'm struggling with my screen. Okay, so political economy is the relationship between state, economics, and civil society. I'll come to this a little later. There are much better ones which they say what it is. Yeah. So issues considered under political economy are production and distribution of wealth. What is this in simple terms? Anybody wants to define what is production and distribution of wealth? In simple terms, one single phrase, one single concept. Nah? Okay. The GDP, so to say, gross domestic produce. Okay. Second is, it also deals with the political power of the social classes. Who has more power? We also dealt with powerlessness. Who has more power? Those sorts of things. And the third most important one, the make or break one, is the extent of society's reliance on state control of distribution of resources versus reliance on markets. Sorry, I'll explain it a little more. Okay, so economics gives you the tools for distribution, and state has the power to distribute. And that gives you the political economy. All of you with me? Now, what political economy tells you is how much is the state responsible for distribution of resources, or how much is it reliant on the market to do the distribution. Tricky? Any questions at this point? So you get many isms from these. What are the isms in the politics? Which are the isms that you're all familiar with?
Communism.
Okay.
Socialism.
Socialism.
Capitalism.
Capitalism.
Liberalism.
Liberalism. Then
Democratic.
libertarianism. Sorry, libertarianism. Okay. So what it means is, so let us look at each of these isms in a way. What does capitalism do vis-a-vis this, with respect to this? The third point, where does capitalism stand in the spectrum? Okay, let us say, put it the other way. Where does communism
Profit.
stand in the spectrum?
In capitalism, it's profit.
Capitalism it is?
It's profit.
Profit.
No, that is fine. In this third point that I
Market.
mentioned, no, it's like, yeah. So the capitalist depends on the market. The reliance is on markets. Communism? State. Communism, socialism is state. And then there are, yeah. So the liberalism is not how liberal you are as a community. It is not how progressive you are as a community. It is how much you are liberalizing your society towards market. All of you are understanding? Please don't mistake the liberalism for the English understanding of liberalism. The liberalism is how liberal you are in opening up your society for market to distribute the resources. So, as an example, which could be the most liberal state in that sense? Which is the most liberal state? State as in country, okay.
US.
US.
Yes, United States. Okay, which is the least liberal, or which was, or which is, yeah, some of the things you still have some countries. Which could be the least liberal ones?
Maybe Cuba.
Cuba. Okay, so we understand now, no, what political economy does. Okay, so now a society decides how liberal it needs to be, or the state decides how liberal it has to be. And that is why whether Obamacare comes or not, whether Hillary Clinton's medical plan fails or not, depends on the politics of the day. Sorry, I'll explain. During what I think Bill Clinton's regime, Bill Clinton is a Democrat, so it's on the left of the center, even though it depends how do you classify the US one. So Hillary Clinton presented a medical care for all the people in the United States. By the way, just to let you know, United States spends the highest on healthcare and is the worst among all the OECD countries in terms of health outcomes. All of you are understanding now what I'm talking about? United States spends the most, 16% of its GDP on healthcare, but has the worst health outcomes among all the OECD. OECD as in the most developed countries, 32 countries. Also, 1/5 of United States of America population don't have access to healthcare. This despite spending, and now of course, if you see the COVID times, you know what is happening or what happened. America had the worst COVID outcomes in that sense. Yes. So how a society is placed is a political economy question. And it becomes very important for determining the health status of the society. So naturally, what is the corollary? Which systems of medicine, or which system of which ism of society will be better for health? No clue? Which ism would be better for health?
Socialism.
Socialism. Actually, no rocket science. We'll come to that as to why it is so. Okay, so political economy of health is that sphere which looks at what Farmer also talks about structures. Paul Farmer talks about structure, structural violence and all. The type of state structure, political and economic systems that affect population health inequalities. So political economy of health is very important for us to look at if we want to look at health inequality. Who gets what? Who gets how much? How much is it liberal? How much is it state-run? How much is it command economy? Command economy is the word used for centralized systems. So, for example, NHS is, there is a derision of NHS telling that it's a command and control system. But NHS is a little different in that sense. It is not exactly command and control, but not exactly also very social oriented. But anyway, so political economy actually tells you as to where your money is going to. Is your money being spent on reducing inequalities, or is it spent on exacerbating inequalities or increasing the inequalities? For example, are we spending more on Rafale jets, airports, or are we spending more on universal health systems or universal nutrition systems? How much is the corporate tax write-off? Anybody knows the last 10 years how much corporate tax has been written off?
Nearly 15 lakhs crore.
You are underestimating. Anybody else? You are in the near, but yeah, it is 21 lakh crores. How much is it as a percentage of our GDP? Sorry, Mike, it's a little Indo-centric. Yeah. How much is it as a percentage of India's GDP? Approximately 21 lakh crores.
10%.
Actually, it is about 8% of GDP per year. How much? 8% GDP per year. How much do we need for having a universal health system in this country? How much percentage of GDP do we need to have a universal? Yeah, around 3%. How much do we need for having universal public distribution system, a nutrition system? How much do we need for universal PDS? About 2%. How much do we need for Manrega? All of you understand Manrega, no? National Rural Employment Guarantee. How much do we need for that? It's about
30,000
2%. Yeah, 2% actually. So if you add up this 8% corporate tax written off and collect those corporate taxes, you can have universal health system, universal PDS, and your employment guarantee. Do we understand this? And what does employment mean in the real sense? What does employment mean for health?
Better health, more access.
Social determinant, income. Employment means income. Nutrition means social determinant. Health system is also considered a social determinant. Anyway, so give people nutrition, give people, you can give. A state, if it decides, can give. All of you understanding now why political economy is important? The role of the state is going to be very critical. The power to distribute resources, which we talked about. But the state could be contradictory, as Sayantan said, it depends on its ideology. It could, on the one hand, have a health department which would be going around talking about harmful effects of tobacco. At the same time, for the finance minister, tobacco is income in his budget balance, in his or her budget balance sheet. So given this contradictory scenario, what decides is the politics, is the ideology. So if your ideology is having a standing committee chairperson with tobacco interest, there was a standing committee on tobacco in which the chairperson had a tobacco industry interest. And then he will only give you a statement telling that tobacco has not been harmful to the society. There's no evidence. And then adds in India. Do we understand this conflicts of interest? Yes. So if you are a politically, what you call, even for example, US, Obama brought in Obamacare. Whatever it was still much worse. I mean, it is still not a universal system, but America refuses to have a universal system. But the moment who came, what is this? Donald Trump came in, he undermined Obamacare. So the political ideology can make or break health of the people. But the political economy is not only state-centric, and that is where the role of critical consciousness comes in. And that is a contribution by Paulo Freire. We don't need to be fatalistic. The political economy also can be shaped by people. And classic example is Europe, particularly UK. How for years the labor movements fought to get the health status that they have now. Or NHS, for example. NHS did not come overnight. It was also a struggle over 100, 150 years of the labor movements. So what Paulo Freire is telling is political economy, yes, of course, state has the you can change it through problem solving and raising the critical consciousness of people. And the classic example for us in India is the farmers' struggle, how they reversed a pro-industry, pro-corporate laws in this country through collective action. Okay, this is my mostly last slide on political economy. So, let us take the example of the individual behavior, smoking. A market would say it is an individual problem, it is his or her choice. But a political economy one will look at the larger environment. What is the larger environment? That your film actors smoke away to glory on the screen, depicting machoism, right? Or Marlboro distributes free cigarettes in the Delhi discourse. So the individual behavior is mediated by the larger environment. What is the political economy of this? That the state looks at tobacco as income and hence would not want to have, for example, plain packaging on cigarettes. Do we understand? Let us take the example of kachori, pakoda, bread pakoda. How many of you are familiar with those bread pakodas? Anybody knows bread pakoda? Sorry, Mike again. You can relate it with McDonald's, maybe. So how many of them eat bread pakodas by choice or McDonald's by choice? Not in India for McDonald's. McDonald's is only for Mike. Who eats McDonald's as a what you call staple and not as a choice? Who eats?
Poor people.
Poor people eat. Why?
That's what's available for that cost.
They need energy dense food at the least price. But then you will say it is the individual behavior. They are not getting into fibers. They are not eating vegetables, fresh vegetables and fresh fruits. So if you focus on the individual behavior, again a market phenomena, you are going to do victim blaming. What is the larger environment? Easy availability, for example. And what is the political economy angle? The poverty in the society. Do we understand this? Yes? Clear, all of us? Any questions still here?
Aravindan, you wanted to say something?
Yeah, so Prasanna, so all this is broadly applicable, all the discussion is broadly applicable to political economy of education also.
Yes,
right?
yes. Yeah, very much. I'm just giving the health angle, that's all. Oh, political economy of education is much more a mess. Anyway, Yeah, Ritika.
I'm in agreement with everything you're saying. However, do you think that rehabilitation of PD workers, and given that PD rolling is also an occupational health hazard recognized by the WHO, rehabilitation of PD workers problematizes this articulation of political economy with respect to tobacco? And what would be your response to that?
Yes, yes. So generally, with regard to tobacco, there has always been a demand side regulation, increasing taxes, increasing whatever, those sorts of things. Yeah. And increasingly, people are looking at supply side economics also. Like, for example, there's a group in Harvard which is looking at how to wean farmers away from tobacco and understanding. So, without, of course, definitely, without rehabilitation of those people, we are not talking in thin air. Again, that's a political economy. Are you investing enough in the rehabilitation of BD workers? But if you think that tobacco is the income for you, then why would you be interested in rehabilitation of the BD workers? Are you getting it? Yeah, did I answer?
Yeah, you did. Thank you.
And then you have something in between the extreme market orientation and extreme command economy or socialism, what is called as a welfare state. So what does the welfare state do? Welfare state encourages markets. At the same time, it then reinvests or redistributes the wealth created in the economy. Sorry, I will try and explain. So you have, what is the definition of wealth? I mean, how is it measured in any society, in any country? How is wealth measured? What is the parameter again? GDP. Correct? So what is GDP in plain terms? In very simple terms?
Yeah, country has.
No, very simple terms. What does it mean to us as people? Sorry, is somebody typing in chat? I'm not observing the chat.
Ram has said per capita income and multiplied by number of people.
That is okay. I'll not come to per capita. I'll just retain the income. It is not very far from what I wanted to. Yeah. So if it is per capita income, what does it mean in simple terms, Ram?
The amount that an average individual earns in the country.
Correct. My salary, whatever, my salary or internship, any of those things would contribute to the GDP. It also includes the GDP, I mean, income of Mukesh Ambani, Adani and all. Clear all of us? But me getting my salary, does it mean anything to the government? Or when will it mean anything to the government? At what point?
You're contributing as taxes.
Correct. So if you pay taxes, am I clear? You pay taxes, that only has meaning to run an NHS, to run a national health mission, to run whatever, any of those. So that is the welfare. And that is defined by tax to GDP ratio. Sorry, should I use the whiteboard? I'll stop sharing this. Yeah. So it is defined by, all of you are able to see this? Am I sharing?
Yes.
Clear, all of you? Tax to GDP ratio defines how much money the government has. Otherwise, GDP has no meaning. It could be just you running away with your money. Am I clear? Now, if you are looking at tax to GDP ratio, what would that say? How should it be for you to have a welfare state? High, low, very high, very low?
High.
It should be high, so that you have more money to redistribute. Okay. Now, let us compare two countries and their tax to GDP ratios. So, what is the tax to GDP ratio of India? You can do Google data if you want to. What is the, oh, what is the tax to GDP ratio of India?
26.6%.
No, that is too less. 3 chances. Auction. Yes, anybody? Okay. It is at 13%. 1-3. How much?
13.
Where are we with respect to, sorry, where is India with respect to life expectancy?
Around 70 years.
Yes. Correct. Now, what is the tax to GDP ratio of Sweden? What could be? Unless you're doing Google.
Sweden is a welfare state, right? So must be quite high.
How much? Give a guess. Okay, 40% one time. Another 2 chances. Ritika says 40%.
60%.
Sorry?
60%.
60. Okay. Second chance, third chance, last chance. Nobody wants to guess? How much? It is 51%. And what is the life expectancy of Sweden?
90 years.
Too high.
I'm just taking a guess.
Fine. It's 82. So, if you throw peanuts, you will get monkeys. Other way to put it is garbage in. If you put garbage into a machine, what will you get?
Garbage out.
Yes. So, how much a government spends, the tax to GDP ratio actually determines the health of the nation. So, in Sweden, for example, because it's a welfare state, health is universally free. Education is universally available, free. Are we understanding this? So, if you have so much of taxes, then you will have better health outcomes. So the tax to GDP ratio is a very important one to look at how much of redistribution is happening. So if you are a political economy which is believing in the market phenomena, what would happen? What would be the tax to GDP ratio? Anybody? We have been a very muted crowd today.
Very low.
Why? Why would it be low if you're a, for example, right-wing government, or if you're a market-oriented government? Why would it be low?
It will simply be low because for the market logic, it's dead spending. It's not adding to any product efficiency. It comes from the
Yes.
same logic that if you give things to people for free, individual behavior, they'll be lazy, they won't do anything anyway.
Not that way. I'll come to that. But what you are saying, the direction is correct. That you tax the industries less so that you get more output, more GDP, so to say. Clear, all of you? So if you are a command economy, or if you are a socialist economy, what would you want to do? Yeah, trickle down is one more way to look at it. Huh? If you are a social one, what would you do?
Tax individuals
Tax?
more.
Yes, there will be more taxes for the individuals. The government is stepping in and then doing the redistribution much more. So that is the welfare state that we are talking about. Am I clear now? All of you? That you have to have proper tax to GDP ratio in order that you are in a position to generate resources for health.
Prasanna?
And again, this is not, yes, who is it?
I have a
Arvind.
question. Arvind here. So the tax to GDP ratio alone does not directly correlate to better health outcomes, right? So but there are other factors. The ideology of the government also decides where the money generated is spent. For example, if the government wants to spend more on defense versus health, then it does not correlate directly to the health outcome.
No. One of the causes is that if your tax pool itself is very less, for example, and even there you are distributing it also in a skewed manner, definitely yes. Only tax to GDP is not the issue, but tax to GDP tells you as a nation where you are heading in terms of redistribution. Are you letting runaway profits for the industry, capital, or are you also putting a what you call leash on it and then converting it into assets for the people? So again, the market doesn't recognize this. The market simply says, if I have more GDP, I will fly, I will go, I will travel, I will get the US visa, whatever. Market doesn't say that 40% of the people don't have anything. You have to work on that. So market logic doesn't recognize the inequalities. And that is where you need the redistribution. And the more market oriented you are, the less you will redistribute. That's the point I'm trying to make. Yes, we have made the point previously of what it makes to distribute the resources. Yes. Even within the collected resources, you are giving more to defense. That's a problem. How much is it that we are spending on defense? Anybody knows as a percentage of total
Maybe
government spending?
4 times than health, I think, in India. 4.8.
I think it's about 20 times. I think 32% is on defense of the government expenditure I'm talking about, not the GDP. And we are somewhere around 3 to 6% on health. So that is the distribution, that's the politics. But at the same time, even redistribution is defined by the taxes. Clear now, Arvind?
Yes. Thanks.
Okay, so that's what it means, some more definitions. Okay, there are types of welfare state, and Navarro's seminal paper, I have put it up in the reading thing. It shows as to what sort of a government gives you what sort of health outcome. Even within welfare state, there are 4 classifications that Navarro fantastically elicits. And then he sees that the social democratic, which is based on citizen rights and not on workers' rights like Germany, has a better health outcome than Germany. Germany and France have better health outcome than US and UK. And US and UK have better health outcomes than Spain and Portugal because of their fascist nature. So the more authoritarian a government is, the more market orientation it could be, or less welfare oriented it can be. So the health inequalities depend on what type of political economy your country is following. Is this message clear now? All of us?
Yes.
Okay. The next point is this famous, what is called as Preston curve. What are we seeing here? Anybody wants to give a guess?
That after a certain increase in GDP, the life expectancy plateaus.
That is one way to look at it. Then? Anybody else?
US is an outlier.
Yeah, that is one other observation. But what is the general trend?
At a very low life expectancy, even incremental changes in GDP increases the life expectancy to a large extent. After the plateau part, which Gayatri mentioned, then that effect flattens out.
No, the plateau part is largely US.
Yeah.
If you see Japan, France, and all, they are much better off. Anyway,
Right.
okay. So the idea is that life expectancy as a proxy for health increases with GDP per capita. That's very important. But there are outliers. Who are the outliers?
South Africa,
Yes.
Equatorial Guinea.
Yeah. But their life expectancy is not up to the standards, again because of the inequalities in the society and those sorts of things. Because again this averages out. Then again the outlier is US. Of course, somehow Sri Lanka has got left out, but Sri Lanka at very low GDP per capita has better health outcomes. So these are all the outliers. So broadly, the economist argument is increase GDP and you will get better health. Are we understanding this? I think I will be only able to do this political economy today, I think. Looks like. So the economists also argue big time on this. And that is the debate I have put between Amartya Sen and Jagdish Bhagwati, two leading economists of the world. So Amartya Sen says you need to have better redistribution for you to achieve better. I mean, he is still in the market logic only. He has not come to the social logic, but within the market logic, Amartya Sen says you should do the redistribution better. There has to be much more public endeavor. That is, the state must actively come in to develop what is called as endowments. I'll come to what endowment is. Then Bhagwati says, no, you need to increase the size of the pie for you to do the redistribution. All of you are understanding this? Sorry. Again, I'll have to use the whiteboard, I think. Is there a circle in this? In the shape. So if this is your GDP size, and then Amartya Sen says you have to do redistribution. Redistribution as in, let me see if I can draw inside this. No, it cannot, no. I can. Nice. Sorry, 2 seconds. I am experimenting myself with all of you. This is the tax to GDP we discussed, right? So Amartya Sen says you should increase this pie, this triangle within the pie. All of you understand this. So that the governments can run NHS, governments can do National Health Mission and all those things. But this is anathema, and I'll come to that as to why. And then Bhagavati says, don't do that. Can I increase the size of this? How does one increase? Sorry, I'm being very clumsy. So Bhagavati says, give incentives for industries such as tax-free zones, such as lower taxes, so that you increase the GDP. Automatically, this line increases your size of the pie. Are all of you understanding now? Sorry, with my crude drawing. So you are at 10 crores, for example, as a GDP. Sorry, 10 crores is what? 100 million. I'll have to keep thinking in a non-Indian way. 100 million if your GDP is today, increase it to 200 million. So 10% of 100 million is only 10 million. At the same time, if you increase it to 200 million, you will automatically get 20 million. You will get more money for doing what you call redistribution. All of you with me? Are you understanding this? So the economists debate this big time. And that is the debate between, that's a debate that happened in the context of the general elections of 2014 in India, in which Kerala was posited against Gujarat. While Amartya Sen said Kerala is the better model, Bhagwati was telling Gujarat is the better model. Now I do this argument, and Arvindan and others can be silent. How many of you understand special economic zone? What's a special economic zone?
It's a designated corridor for offering incentives for industries to set up shop.
Correct. What is the big incentive?
Tax rebate.
Tax free.
Tax free. Okay. Now let us assume, and I'm not assuming, this is a real example I keep giving. There is Western Ghats, Ratnagiri. I don't know if somebody is from Maharashtra. Yeah, Ritika is from Maharashtra. Ratnagiri is prime, pristine Western Ghats ecological zone. There, Reliance wanted to open a chemical SEZ, a tax-free zone, chemical tax-free zone. Okay. Now, any SEZ will need about 10,000 hectares of land. All of you know this? I'm giving the information. And what is the average land holding in this country?
Less than 5 acres.
Yeah, 5 acres. Are you going by hectares?
Two hectares.
Sorry, are you able to hear me now?
Yeah.
Yes.
I lost the battery of my headphone. Anyway, Okay, so average land holding in this country is 1 hectare. That is 2.5 acres. Okay. Now, if you need 10,000 hectares for SEZ, how many families would you need to be displacing?
Yeah, around 10,000.
10,000 families. How many number of people? 50,000 average. Any reason why you want to close this, Anton?
No, okay. I'm able to see everybody now. Sorry, it was a thing on my end.
Yes. Okay, so now these 10,000 families, what are their basic skills?
Agriculture.
Agriculture. Now, what is the SEZ being planned? What was
Chemical,
the SEZ
right?
that was planned?
Chemical
SEZ. So can these 10,000 people get the job there? 10,000 families, for example. Get the job in that SEZ?
No,
Why not?
not enough.
What not enough?
Not enough jobs available.
No, that is one part. But even if there were jobs, let us assume, can they be employed in the SEZ?
No, their relevant skill set don't match.
Precisely. So at the maximum, what skills, what positions can they become, can they get the job on?
Security guard, perhaps.
Security guards, grade 4 workers, and those sorts of things. Okay, so let us assume 2,000 families got the job. Where are the rest 8,000 families going?
To an urban poor area.
So which is the nearest city to Ratnagiri?
Mumbai.
Where will they go in Mumbai to?
Dharavi.
And if you live in crowded conditions, what would you have?
Tuberculosis.
So who should run the DOTS program?
The SEZ. The chemical.
Who should run the DOTS program?
Government.
Oh, so naturally you tell, Iman, Okay, so if the government has to run, how will it run a DOTS program? Through what? How? What is their source?
Taxes.
Oh, Sayantan, thank you. If taxes, and what is the SEZ?
A way to get less tax from certain group of people.
Do we understand this vicious cycle? Yes, no doubt GDP will increase maybe, but whose GDP increases? That is the debate between Amartya Sen and... So if you want to increase the skills of the farmers, for example, let us assume, who should run the schools? Who should run the schools?
Can you repeat the question, please, Prasanna?
If you want to increase the skill levels of farmers, let us assume the SEZ is there and you have to make them capable of it. Who should run the schools? Will the private sector be interested?
No.
But
So
yeah, they have CSR, right?
Thank you. So the CSR, I'll tell you one saga. The Coca-Cola factory in Plachimada runs a CSR for water conservation, by the way. So that's the story of CSRs in this in the global scenario. Anyway, we'll come to that later. Okay, so CSR is again apolitical, not able to recognize equity. CSR is also a PR project, public relations. It isn't necessarily a what you call equity generating sort of endeavor. Okay, so the government has to run again. So what Amartya Sen says is you have to build these endowments. And the endowments can come only from tax to GDP. But conventional orthodox economists say increase the GDP, increase the GDP. By the way, we are the 5th largest economy in the country, in the world. And that is again a wrong parameter to look at. The real parameter to look at is per capita GDP, where we are 192nd, I think. Do we understand this?
Prasanna, I was going to ask you, so that you showed a circle and outside circle and a pie and all that, right? So did you mean it to be a GDP or per capita GDP?
No, GDP. Per capita also I can take it up, but it doesn't matter.
Capita, right? Because if it is GDP, the larger circle means that more population. So then the increase in the size of the pie doesn't directly mean anything.
Yes, that's what I wanted to. No, increase in the size is also okay. For example, if your GDP per capita, I mean, this is the overall GDP, sorry, not the per capita one, but even otherwise, the idea is if your overall GDP increases, your per capita also increases because it's anyway averaged out. That's not the idea. The thing is, supposing your GDP was 10 million and you increased it into 20 million, then 10% or 13%, wherever you are, 13% of 10 million is definitely lesser than 13% of 20 million. That is the argument of Bhagavati. But what Amartya Sen is
there are
telling,
more people needing the services, right? So in that case.
Correct. So Bhagavati's thing is, he says go in 2 phases. First, increase the GDP, reduce taxes, encourage productivity, increase the salaries of Mukesh Ambani. Automatically, the driver of Mukesh Ambani will get more money. That is again percolation theory. But who wins, who loses, that is the question that we are talking about. And that is a big political economy question. The so-called fifth largest economy doesn't mean anything at all, because the GDP has Mukesh Ambani's salary and Adani's salary, and the top 1% has 80% of India's GDP, for example. Are we clear now? So, you're robbing, sorry, Arvind, you still have some question?
No, I'm good. Thanks. Yeah.
Okay. Are we good here? So this is the argument. Then comes Partho, the third one. Both Amartya Sen and Jagdish Bhagwati are talking no logic. Because if you have an SEZ in Ratnagiri, pristine Western Ghats, pristine ecological zone, your GDP doesn't matter if you have the ecology spoiled. So this GDP based arguments also have a counter now in the context of climate change, in the context of climate related disasters, that no amount of GDP will help, because it's again the poor and the vulnerable who are going to get affected by this. Am I clear? Yes? All of you with me?
Yes.
Okay. In the last 20 minutes, I'll try and see if I can finish one more topic. And then we have a new concept. I'll close this. So once we understood this now, that you should increase. So conventional economics says you should increase the GDP. How do you increase GDP? Give tax concessions to people, you will generate more wealth, and then you can do many more things. That's the logic. And then comes another political economic question, what is called as neoliberalism. Again, liberalism is nothing to do with your progressive thinking. Liberalism is about how much market orientation you are going to give your society. Okay, let us come back to the market logic. All of you remember the famous Adam Smith market logic? Yes? So how can you become efficient?
By reducing cost of production.
By reducing unit costs. What are the ways in which you can reduce unit costs?
Poor quality of the raw material. Reduce quality.
No, if you use poor quality raw material, you are out of the market.
So reduce the salary of the.
So which are the components? Which are the inputs needed for
man
production?
hours?
Human hours. Yeah,
Raw
or human
material.
power, so to say. Yes. What else?
Raw material.
Yes.
Externalization.
That is too fast, Iman. We'll come to that. Marketing costs and so on. Okay. There is one more important component here as part of the cost. What is it?
Technology?
That could be considered as capital, raw material and all, but anyway, I'll put it here. One more.
Time? No.
That is human power.
Oh, taxes.
Okay, just keep this in mind. I'll draw a new one.
So is it the government support like subsidies and all that?
Yes.
Yes. Are you able to see the pens? No? Anybody? Yes or no?
Prasanna, we can't hear you. Are you not saying anything, or is there an issue with the audio?
Oh, is it so? Am I not audible? Okay. Now am I audible?
Yes, now you are.
Oh, okay. So are you able to see the pens, all of you?
Uh, we are only able to see the whiteboard.
Oh, not me.
He's
My
holding
video.
the pens.
My video?
Maybe only I cannot. Maybe if Ritika is able to see, maybe it's just me.
Okay, so these 4 pens are there. What is happening between them? Competition. So if I don't survive the competition, what happens to me?
Bankrupts.
Bankruptcy. What is the textbook definition of bankruptcy?
Can't pay your bills.
So what does it mean?
The production cost is above your selling price or whatever.
No, bankruptcy definition is not that.
No liquidity to pay
Precisely.
salary.
You might have great assets, but if you don't have money to pay your electricity bills and salaries, you are considered bankrupt. For example, Jet Airways had all the flights and everything as assets, but they did not have liquidity to run the market. Now the question is to all of you, can governments go bankrupt?
Not if they have their own sovereign currency.
What do you mean by that, Mike?
That the government creates the currency.
So they can print money, is what you're telling.
Yeah.
Of course, when they print money, inflation increases and all, but technically governments cannot go bankrupt. That we came to it very fast. This is the fastest we have come to, Mike. Anyway, so if I don't have the disincentive of going bankrupt, what is my behavior? Am I behaving in a market or am I behaving monopolistically?
Complacency.
Sorry?
Complacency.
Yeah, so what does it mean?
Monopolist.
If I'm not able to go bankrupt, what is my behavior?
Monopolist.
Is it market behavior or monopolistic?
Monopolistic.
Yes, because I can't go bankrupt, I will be monopolistic. So for economists, government is a monopoly. All of you are understanding? Monopoly, what is the corollary? No competition, no efficiency. Am I clear?
But it's an assumption, right?
No, it is economist basic theory. It's not assumption. They are not worried about equity. They are only worried about efficiency, scarce resources and all. Ram.
Correct.
Okay. Now come to this. Again, come back to this previous box.
One sec, Prasanna. I think Ram raised an important question.
Yeah.
Could you delve on it a little bit now or later also?
Which one?
The question that Ram had just asked about the entire motivation for the government, efficiency versus equity. So can you explain it a bit with the economic logic?
Yes. The economic logic, as we looked at economics, we said that economics or markets don't worry about equity. They're not concerned about equity. How inequitable you are, what it is, jo jeeta wahi sikandar, that is winner takes all. It is not worried about. The only thing or two things that economics or markets worry about is, one is scarcity and accordingly efficiency. Efficiency as in productive efficiency and allocative efficiency. Okay. So if we are concerned only with efficiency and the government behavior is monopolistic, I consider the governments as having low efficiency. And that's what we also see, in all the newspapers, in everywhere. That's what they propagate. See, your hospitals are miserable. Your public distribution system is terrible. So you keep on nodding and then say, that is why you should leave it to the market. That is the argument. Okay. Now, come back to, sorry, Sayantan, did I?
Yes, you answered it. But again, another question is coming in. Does the NGO sector also fit in here somewhere then?
That's a fuzzy sector. Anyway, I'll come to it. That's a non-profit sector.
Sure.
Not today maybe, but anyway. What's happening here? Let us come back to the previous box. I want to reduce my unit costs.
Prasanna, can you hold on to
Yeah.
minute? So if the claim that state cannot go bankrupt, the government cannot go bankrupt, can you explain that further?
Okay, so the
Ram said
government,
it is an
as Mike
assumption, and
said,
you said it's not. It's a proven. Is a proven theory.
Okay. So what Mike said is governments can print money.
Yeah.
So they can always have liquidity. It is another matter that, for example, if something is costing you 1,000 rupees, if you pump in more money, that same thing might cost you 10,000 rupees. But the government is not going bankrupt. It is only printing more money. And hence, because it cannot go bankrupt, its behavior is monopolistic. It doesn't fit into the market logic of efficiency and of the invisible hand.
Bankruptcy was very much the pretext for the liberalization of the
We'll come to that.
So,
just hold on. So let's come back to this box. All of you are okay now? Sorry, I'm switching between concepts and what you call evidence, but I hope I'm making sense. So if I have to be competitive and not go bankrupt as a private market entity, what should happen? I should reduce my unit costs. What are the ways in which I can reduce the unit costs? In these 5 items, for example. Where can I reduce?
Wages.
Wages, how?
I can either exploit people, say, get more done from less time from the same people, or pay them less for how much ever they're working. The rest are somewhat market driven.
Okay, so let us split the wage component. Let us say salary. What else would be there as wages if you are a permanent employee?
Pension.
Pensions, or what we call broadly your PF, your pension, all of those. Clear, all of you? Now, in these 2, where can I reduce what and how?
Contractualize, then you don't have to pay.
Sorry?
Contractualize it.
Correct. If you contractualize, what happens? You can give piece rates. You can give hourly rates, whatever, and you don't need to worry about social security. So that is one way of looking at it. Correct? Now, where else can you reduce? That is human power we discussed. Through contractualization, you can overcome or you can reduce your unit cost. Where else can we reduce?
You can change it to technology, robots, AI, all of that new age stuff.
Fair enough. That is one way. Other way? Others?
Monopoly, you don't need to spend on marketing.
Yeah, but we are talking about markets now. We are back to markets, not monopolies. So supposing I am a chemical plant. What happens? What should I put in as a necessary thing in the plant?
Safety guidelines.
And what else? I'm a chemical plant. we need to have
treatment for the chemicals before they
correct,
discharge into
effluent
whatever
treatment
place.
plants.
Yeah.
Effluent treatment plant. That is regulation. The state has to bring in, for example, the public pollution control board will bring in regulation telling that you should have STP or effluent ETP, both of them. Okay. If you do ETP, you will have more costs. Yes or no?
Yes.
So if I have to reduce my unit cost, what will I do? Given a choice, I would not want to have effluent treatment plant. Yes or no? So what happens downstream?
People fall sick.
People fall sick. So what happens to them when they fall sick?
They lose their wages.
They lose their wages or they pay for their sickness. Right? So that is what Iman jumped at that time, and then I had to stop him, as called as externalization of the cost. So you're externalizing. You did not invest, so somebody else is paying for that. So the one way is regulation. Yeah, negative externality. Then there is another component. Who taxes you?
The government.
And what is the government according to the definition?
Monopoly.
So the logic of market is, here is an entity which is monopolistic. All of you get this, huh? Here is an entity which is monopolistic, putting taxes on me. It's already inefficient, being monopolistic. It is taxing me, regulating me, and making me also inefficient. Am I clear? Is this clear?
Yes.
Anybody else? Ram?
Not very.
Okay, so government is a monopoly. I want to be efficient as a private industry, for example. But government is applying taxes and regulation and everything on me, making me also inefficient. So, why should I have the government? All of you are understanding what I'm talking about? So in Hindi they say, na rahega baas,
Na bajegi bansuri.
in the sense that if the government is there, it is going to tax me, and then it is going to regulate me, and it is going to make me inefficient. Why have governments? And that is neoliberalism.
But Prasanna, as per classical economics, you need the government for private property to be protected for the entrepreneur or the.
That is a topic of another realm. It's in the globalization realm, trade realm. We'll come to that later. Yes, what you say is true. That the more the government, the better for the market. In fact, but neoliberalism says, do away with government, because governments are inefficient and monopolistic, and you should have minimal government. Laissez-faire economy, fantastic science. So when your prime minister says minimum government, maximum governance, that is a neoliberal dogma. Avani, that's okay. You should, I'm trying to be as simple as possible. Sadly. Yeah, ask me any question. What is it that is not being followed by you?
Prasanna, you just said that the government is better for the market. What
Yes.
Can you make it a little simpler? What does that mean?
Who opens up the markets? Who facilitates the corporate tax write-off? Are you understanding what I'm telling? So if you don't have government, your markets cannot work, actually. Yeah, no, it is. Ram, you are correct. It is like your what you call. Yeah, your simile is good. Your metaphor is a good one to understand that you are killing the golden egg. Fine. Avni, you want to unmute and then ask me what your question is or what you are not able to follow.
Just like the last thing, the neoliberalism, I didn't get it all.
Okay, so
How
the
can-
idea is for markets to be efficient, one of the component is taxes. And according to market theory, government is monopolistic, that is not efficient. But it is putting taxes on this so-called efficient system and making them also inefficient. So they are saying we should not have governments. Governments in the form of taxes, in the form of excise duties, customs duties, in the form of so-called those barriers. If you remove those barriers, we will be fantastic. The farmer in India can export his carrots to America freely without any import duties, without any of those. Am I making sense now? Amni? Good. Okay. It is too tough for me to get into decentralization now, Vasu. We'll see how we can.
Jonathan had one thing. He said, could you touch upon the differences between charity versus endowment versus entitlement?
Okay. Tough questions in the last 5 minutes. Anyway, charity is a voluntary effort. Endowments are created by state endeavors. What I mean by that? Somebody, I think in the previous session, asked about education, type of education, and those sorts of things. Let us say, I don't know who spoke about the education, quality of education and all last week. Anyway, what is the evidence as to who gets education naturally in this country? Who gets educated? How many of you? I mean, given a choice, I did not like schooling for learning. You are from Teach for India, Ram. Yeah, you should be telling. Who gets education in this country naturally?
People who can pay for it.
Or what is the evidence? Schooling is miserable. Even I hated schooling for learning. Friends, playing, all this is fine. But I am a double postgraduate. How did this magic happen? Despite me hating the school. Quickly, please, somebody. We don't have much time.
Social construct?
Sorry?
Because of RT.
No, RT doesn't apply for me, no? How did I get double post-graduation in the natural way despite me hating the schooling?
Social expectation?
Now,
No.
evidence is if my parents are educated, education happens naturally to me. Not even education, literacy. Okay. So how did my parents get literacy or education?
Because their parents were.
Precisely. So if you go back in the lineage, okay, you will have somewhere land holding, a jewelry shop, a provision stores or something like that. What Amartya Sen calls as pre-endowments. Now let us imagine the slum child. What is its pre-endowment? What is the pre-endowment for the child?
Debt, maybe.
Debt. domestic help mother, construction laborer father. And will they be literate? Most probably not.
Prasanna, can you please explain what you mean by pre-endowment?
So I told you how education comes naturally to you and me. I said I hated schooling. Despite that, I'm a double postgraduate. How did this magic happen? Evidence says that my parents were literate or educated, and hence it happened. And then Ram or Sayantan said their parents were, my grandparents were educated, so it was somewhere in my lineage there was land holding. That is some asset, some endowment. A jewelry shop, a provision store. It could be any of those. Are you getting what I'm telling? So that is how education happened naturally to me, even though I did not like schooling. So now come back to the child who is in a slum. What is the pre-endowment? And the market doesn't recognize this. Now, are you understanding the difference between charity and endowment? And now I'll come to entitlements. Ram said right to education, even though it has its huge problems. What does rights mean? What does rights mean for people?
Inalienable, not violable.
They can demand, they can claim,
Guaranteed.
they can, yes. That means you are empowering people, or you have given them a stake, a claim, as against a charity. Charity is today I do some schooling or I run a school, I can close the school and go away. Nobody can question me. But if it is a right, then it has to be guaranteed. It is an entitlement. And that's the difference. Have I been able to explain this? The three things? In the time permissible? Who raised that question?
Sayantan. He's showing thumbs up.
Okay, great. Thanks. Okay, now the final point. Okay, so if governments are the problem with its barriers of import duties, customs, excise, taxes and all, we should do away with the government. And thus was born the neoliberalism. And neoliberalism said governments have no business to be in business. Do we understand that phrase? So if you listen to some of these statements, governments have no business to be in business, minimum governance, maximum governance, your antenna must go up. And the third phrase is governments must steer, not row. Are we getting these three statements? Let me see if I can type it fast. Oh. Minimum government, maximum governance. Governments must steer, not row. If you hear these statements, then you should raise your antenna thinking, okay, this is the neoliberal dogma which says government should get away from expenditures. So health is expenditure, by the way. Education is expenditure in the balance sheet. While tobacco is income, alcohol is income. So the neoliberalism says governments should not be running health centers because governments are by nature monopolistic and hence inefficient, and hence you get terrible services. So leave it to the private. Leave it to the market will correct itself. Am I making sense, all of you? I know it's the last 5 minutes, but please bear with me. I'll close with that because that is very important to understand the next session of neoliberal. So what are the major issues with neoliberalism? Sorry, I opened the wrong. Shit, sorry. So it says private property is most important. And governments must make sure that the private properties are protected. And what are the prescriptions of neoliberalism? And that's the last slide for me today. The structural adjustment programs. What are these? Reduce fiscal deficit, devalue currencies, open up for markets. That is, you move to the market side of the society rather than being the command economy. This is the political economy. All of you are understanding? So governments withdraw, move back, laissez-faire, don't do anything, leave it to the market. Governments are barriers for efficiencies because governments are monopolistic and they also put taxes which are barriers. Reduce government spending on social sectors. Reduce subsidies. So whatever endeavors, public endeavors or pre-endowments that you need to create, don't get into it. You are inefficient, so you should not be there. Increase privatization and commercialization. Put user fees. You see, governments are all very weak. Resources are not there. So you should recover money. Gayatri can pay. So Gayatri should pay. Prasanna must pay. Otherwise, Prasanna will run away with free services. And then comes the targeting. Target versus universal systems. Well, see, Gayatri is using the public facility. Why? She is wasting public resources. And universal systems, we'll talk a little later. It needs a much more detailed one. And of course, the belief in vertical program. What is vertical program? Don't worry about Almata, health for all. Don't worry about health. Treat diseases one by one. We had the fantastic example of smallpox. So we will take up polio. We will take up. But the last 40 years, we are still under eradication of polio. So these are all the typical prescriptions. Again, purchaser provider split. This I will take up when I talk about PPPs and health financing. So these are the ways. Basically, what it means is governments withdraw. You have no business to be in business because you are monopolistic. Don't run AIMS. You are wasting money. You are being inefficient. Why do you want to run AIMS? Leave it to the Apollos and Fortises. They will be fantastic. Your business is only to steer, not row. Clear, all of you? And we should close here. By the way, I've taken exactly 2 hours, by the way. We started at 6:38. Anyway, sorry. Yes, any questions? Any last minute?
Any quick questions?
Energetic questions if people have.
We don't have too much time because the Zoom account needs to be used for another meeting.
Oh, okay.
But if any questions, quick questions, at least if you tell us.
No, Gayatri, I just spoke to the others. We can extend for a bit. We can use this account for a bit. We can have some questions. Yeah.
No questions? All clear? Please use the discussion forum. It was fantastic to get the feedback. Also, some great discussions happening there. Yes, Ram, we will discuss. I mean, that was a discussion that Abhay led as to how Apollos and Fortises are now having venture capitalists and all. So we don't, I mean, where is health in all this is the question. And that's the question that you need to keep asking. Whether we are in a health session or whether we are in a market session. Anyway.
Okay, I think we're good. There's no more questions. Please, just a reminder, you can use the discussion forum at any time to ask questions that occur later. Vinny, if you feel that there are still some things that need to be sorted out, feel free to reach me at any time, of course, and I can set up some kind of dialogue with Prasanna and ask some more questions later.
I
Thank
thought
you.
Mr. Bach had a question. So
Sorry, Bach. Sorry, I can't see that view, so I can't see this thing. Go ahead, Bach. Bach, did you have a
Still
question?
there?
No.
No. Okay.
Fine.
Okay, great. Thank you so much.
Thanks.
And hope to see you again next time.
Yes, I'm happy to do that.
Thank you, Prasanna.
Yes, we will do that, sir.